Good morning, everyone. My name is Captain Patrick Williams of the Alexandria Fire Department. I have served this community for over 27 years, and I am proud to call Alexandria my home. To Mayor Jeff Hall, City Councilmen, citizens and friends of Alexandria, I want to thank each of you for taking the time to attend this presentation. I won't be before you long. However, I do want to share some staggering statistics with you and hopefully gain your support as well. In the past several years, the city of Alexandria has witnessed a significant number of overdoses credited to illicit drug use. Overdosing is a citywide problem affecting every demographic within its borders. Alexandria is facing a crisis that seems to be overlooked by our community. As a company officer, I have observed the effects of people overdosing on heroin, fentanyl, oxycodone, and other opiates. Often these overdoses occur during casual and recreational use. Our department is saving lives by administering Narcan to these individuals, but many times we arrive too late and the end result is death of the user. In early June this year, I suggested to the mayor, city officials, and other interested parties that a community risk reduction plan may be just what the city needed to mitigate some of the risks within our communities. What is a community risk reduction? Community risk reduction is identified by the National Fire Protection Agency Association as actions, plans, programs, and other services utilized in the community to prevent or mitigate the suffering, loss of life, property, and resources that support life, safety, fire prevention, and other disasters that can affect the community. Simply stated, CRR is a proactive process of reducing and mitigating risks that poses a threat to life, safety, health, and property. Its goal is to also foresee and mitigate risks before they occur. It is a 5-step process that involves: 1, conducting a community risk reduction analysis, which collects data and demographic information that reveal the risks that are most detrimental to the community. 2, by developing community partnerships, which entails establishing relationships with stakeholders that share the same goals and are willing to participate in the development and implementation of the plan. 3, create intervention strategies. According to the 5 E's of the development intervention strategies, which are emergency response, education, engineering, economic incentives, and enforcement. These strategies are then prioritized according to their feasibility, impact, and probable success. Step number 4, meaning to implement the plan. And station 5, evaluate and report the results and make changes as needed to the plan. Therefore, the Alexandria Fire Department, in conjunction with the Alexandria Police Department, Rapides Parish Sheriff's Department, along with Alexandria Mayor's Office, City Council, and private entities, came together to develop the Overdose Crisis Community Risk Reduction Program. During our community risk analysis, data revealed that in 2020, there were 201 overdoses, and as of July 2021, a staggering 186 overdoses were reported by the fire department's reporting system. These numbers are expected to more than double before the year ends. A majority of these incidents involves young black males between the ages of 18 to 45 and black females ages 20 to 45. Another startling fact is that the majority of these incidents occurred mainly in low-income and impoverished areas of neighborhoods. In most cases, fire and emergency personnel are able to reverse the effects of these drugs with the use of Narcan. However, many of these individuals fall fatal to these drugs overdoses. In our assessment, overdoses were deemed the greatest risk in the community, and deaths by gunshot came in as the second greatest risk. Next, our coalition team developed short-term and long-term intervention strategies and prioritize them according to their feasibility, impact, and probable success. Our short-term interventions were: 1, to provide Narcan to known drug users; 2, the use of social media and other news outlets to inform the public about drug overdoses. And our long-term interventions were to develop educational overdose prevention programs. And lastly, law enforcement agencies would arrest dealers for illicit drug sales. It is the intention of this coalition to conduct a trial run of the plan in a small target area of the community by September 2021. To be evaluated and adjustments made before it is implemented throughout the city. The projected benchmarks for the program are that a 50% reduction of overdose occurrences is reached by December 2021, and a 75% reduction by August of 2022. The program will be evaluated throughout its implementation, and at the end of each year, for assessment and modifications as needed. The evaluation process involves collecting data, comparing it to baseline data, modifying the program as needed, and reporting the results to all the stakeholders. Now, like many of other programs, budgetary requirements and funding resources are needed to support this program. It is estimated that the yearly cost for this program will total in a surpassing amount of $1,357,573. The funding for this program is provided by each agency, or in part by appropriated funds allocated by the City of Alexandria and its citizens. Ladies and gentlemen, thank you for your time and support. I hope that I clearly explained the plan and that I have gained your support. Are there any questions? If no further information or no further questions, if there is a need for further information, you're welcome to call me at 318-730-8673, or you can email me at pwilliams@gmail.com. Thank you again.